Just to make the point, because people have spoken about children not being able to, being hungry or not having glasses, that sort of thing. But I will point out that we have federal programs which provide free lunch and breakfast for high poverty districts. And there is the early and periodic screening, diagnosis, and prevention program, part of Medicaid, which screens for vision. I'm not minimizing the challenges, but I also don't want to ignore that which has already been done. And Dr. Kerwin, I know we both know that Maryland has both these programs. Ms. Neely, look at that. Spending is way up relative to inflation. Oh, I should also say I ask unanimous consent to enter into the record a report from the Illinois policy showing that Chicago public school spending has increased 97%, while student achievement has dropped by 63% in reading and 78% in math. Without objection.
Without objection.
Ms. Neely, look at that. How do we begin to restore the trust when folks say we need to spend more money, but we see so much more money being spent, and yet scores are falling?
Well, let's remember that this illustrious body spent $187 billion in the wake of the pandemic to address learning loss. In the state of Wisconsin, 28.2%, more than 1 out of every $4 of Wisconsin ESSER money was allocated towards new additions or renovations, despite that not addressing learning loss. When all those bills were passed, I think many parents, myself included, assumed that it would be to help reopen schools, for masks, for air purifiers, for sanitation. That is not what that ESSER money was spent on. It was spent on pet projects, it was spent on social emotional learning, it was spent on things like that, and in many cases, districts did not open. Children in inner cities were set back years and years and years. I mean, I remember seeing from Virginia, one of the Virginia Education Association speakers said that the nice thing about this is that everyone went back equally. That's not true. Everyone wasn't set back equally by the pandemic. Those who were more set back were families that didn't have the time or resources to help their children read, to pay for tutors or things like that. This disproportionately hurt low-income students more than anyone else. You have more money that has been thrown at schools. They can't spend it fast enough. All this ESSER money is running out at the end of this September. And yet now we still see teacher shortages. Let's talk about in Hartford, they're about to lay off 300 teachers. In San Diego, they just laid off 234 and are announcing that they're laying off 60 more. There are teachers coming out of our ears. They're not in the right places right now. So we don't have a teacher shortage, we have an allocation issue. And that is what is hugely concerning, particularly when we look at the fact that our children cannot read. They are not thriving, they are doing very, very badly.
Mr. Pandis, you were nodding your head yes as she spoke. What would you add to her comments?
As a former teacher, now policy advocate, I remember my first days in the policy world, and it was a surprise to me then and still is how little those of us who think of ourselves as policymakers spend thinking about what kids do all day. Curriculum, instruction, school culture. Perhaps it's because I'm a former teacher. Those are that's the focus of my work, and I think that is we give insufficient attention to that. I would call your attention to a remarkable series of reports over the last couple of years produced by a woman named Emily Hanford of American Public Media, who has documented the frankly appalling way that we teach reading to children in America. And it's fascinating because it says something about our expert class. It says something about teacher training. That we know how to do this. We've trained teachers badly. Her reports were called Hard Words and Sold. Please.
It seems as if you are indicting teacher training, very much so, that universities, colleges are doing a poor job of preparing teachers for the classroom.
No question.
Is there a statistical relationship between some universities and their Department of Educations and poor performance by their graduates in certain schools?
Oh, I'm sure there is, but I think perhaps at the risk of painting with too broad of a brush, the larger problem is that I'm not sure that our colleges of education view it as their job to train teachers. In my written testimony—
Wait, I'm sorry, that just strikes me as odd.
Yes, that's correct, Senator, and it should strike you as odd. In other words, they may be more concerned with your professional disposition and with theory as opposed to the practical means of controlling a classroom, of curriculum, of instruction.
And in my limited time, Mr. Keyes points out that some of the kids do present with emotional disorder, et cetera. You point out that teachers are being asked to wear many hats, and so therefore it distracts them from their primary function. But granted that some kids, now granted it may be the kids who are from a poorer background.
Sure.
What do we do about that kind of set of issues that are there in addition to?
And I don't want to diminish the reality of that, Senator. It's absolutely a fact. The question that we seldom ask is why is it, or why are we asking what in many cases is the poorest performing institution in a community to do more, to be a social services provider, to provide services beyond their core function. In other words, are there NGOs, are there other organizations in a stressed out community that would be better suited to be a mental health provider, to be a social services provider, than putting all of this on the back of our teachers?
So a school-based clinic with mental health professionals embedded within a school with a high need would be a better alternative than asking teachers to do that.
That's complicated, whether it should be based in the school. Again, the need is real, whether you want a low-functioning institution, with all respect, to be the service provider and supervise and hold that service accountable is the question to be asked.
Thank you.
Senator Baldwin.